All right, good morning, everyone, and welcome to Semel Grand Rounds. I'm Jonathan Helt, the course chair for the series. After a brief hiatus, we're excited to restart our seminar series via this online webinar. We hope that the speakers and topics will be timely and relevant for you all in the coming weeks. As a reminder, we're able to offer CME credit for viewing this presentation. Please check your email after the presentation for a link to complete the Qualtrics survey. If you have any questions, or if you want to see the schedule for future presentations, you can visit the website at semelgrandrounds.com. And without further delay, I will turn it over to Dr. Robert Pinus, who will be introducing our speaker this morning.
Thank you. I'm really pleased to introduce my dear friend and colleague, Melissa Brymer, who's going to be doing the grand rounds this morning. Dr. Brymer attended Providence College and did her graduate work in clinical psychology at Fairleigh Dickinson University and Nova Southeastern University. As a member of our department, she's currently director of the Terrorism and Disaster Programs at the UCLA Duke University National Center for Child Traumatic Stress, the center she will briefly describe along with its activities. Most recently, she was principal investigator for a National Institute of Justice project that examined the short and long-term impact of school shootings and mass violence in communities across the United States, identifying the personal and institutional impacts at all levels of care. She has been the lead advisor to the Newtown Public Schools since the incomprehensible mass 2012 killings at Sandy Hook Elementary School, helping to successfully build, I would argue, the most comprehensive system-wide school recovery program ever undertaken. Dr. Brymer and I have worked together for nearly 25 years, and I've seen her growth from an intern participating in the UCLA Trauma Psychiatry program to creatively managing a UNICEF psychosocial program in Kosovo, living among the dangers when what was to be a refugee support program turned into an active war zone, to initiating one of the first tiered system of care after a school shooting, this one in 2001 at Santana High School in Santee, California, where she not only gave exceptional care to the group of seriously injured students, but succeeded in turning the school principal into their best and most cherished advocate. I have been her mentor during her formative years, but the roles are much reversed today. Much of my learning comes from mining her vast experience, ability to read and process the most difficult of circumstances, and to pinpoint the types of interventions and support that would be most effective, compassionate, and meaningful to the child, parents, family, and community. Our medical center is benefiting greatly from her guidance as part of an exceptional emotional support team led by Dr. Karen Mioto to address the ongoing needs of our healthcare workers during this trying time. Just a few words to set the framework for Dr. Brymer's presentation. Over the many years of our mutual work, we've learned that in the face of an ecology of danger, be it during war, disaster, or a pandemic, we need to embed our traditional language of anxiety, stress, and resiliency into an outwardly directed language of danger, safety, and protection, with fear as an important, legitimate, signaling affect. In addition to a traditional focus on emotional regulation, this change of framework drives attention, the consideration of proactive steps to improve safety and reduce harmful outcomes, and to address ongoing failures of the social contract. A quick example, reinforcing a damaged chimney after an earthquake can be critical to reducing a child's ongoing worries, restoring an ability to sleep. All the CBT on its own doesn't do the same as actually repairing that chimney. And likewise, dangerous and traumatic circumstances often lead to a series of real life challenges, what we refer to as a cascade of secondary adversities, where profound demoralization, not to be confused with depression, can occur suddenly when, for example, someone fails to get a small business loan, challenging the capacity for hope. Dr. Brymer is one of the world's most experienced practitioners and trainers, as well as an author of Psychological First Aid and Skills for Psychological Recovery that integrates this framework. In addition, she's been a subject matter expert for many years for the National Biodefense Science Board and the U.S. Department of Health and Human Services Office of the Assistant Secretary for Preparedness and Response, both of which include preparation and response to a pandemic. It's a privilege to hear from her today.
Thank you so much, Bob. I really appreciate this, and I really appreciate being able to present to our home institution. There's so much that we do nationally that it's nice to give back. So I just wanted to, because I have a different role here at UCLA, that I thought it would be helpful to just describe about our network. So we actually started in October 1 of 2001. And at that point, we were 17 sites, and our mission is to improve the access and quality of care for all types of traumas that are impacting our kids and our families. So those can be domestic violence, child abuse, medical traumas. I head up our terrorism and disaster program in those incidences that usually have more of a national limelight. And so today, we are actually 100 funded centers. And as of June 1st, we were just told Friday, 16 more sites are coming on board. But because we've been in operation for so long, we have 150 affiliate sites. So these are sites that once were part of our network who don't have the current funding, but they're committed to our mission. And so we make sure that our network constantly works together. And so UCLA and Duke University, we're the national centers and we're national center, and we act as one center. Except during March Madness, it gets a little ugly. So this year we were spared from some of those debates. But it has been important in general as we work with some of our academic sites who deal with treatment developments, assessments, and program development, working with our community sites, our schools, our mental health clinics, and fusing our work together so that we can make sure that we meet the diverse needs of our communities and of our children. So I have been with the network since the beginning, and part of our role in that national response is helping local communities respond to natural disasters and pandemics or other public health emergencies. And so why I bring up some of our responses is that part of the work that we're doing is we're always looking at lessons learned and how does that apply or not apply to our current circumstances. So even in 2004, appreciating the multiple hurricanes that impacted the panhandle of Florida and what that did to the toll of that community and the extra efforts that we had to do to support that community as they had 4 different hurricanes impact them that season. We also had the experience from Katrina. Because we're a national network, we were able to support those communities that were impacted by the event, but also those communities that were receiving people as they were being relocated. And so we were able to actually have a national response similar to what's being called on today. We've had the opportunity of working with a lot of our territories, both in Puerto Rico, Saipan, American Samoa. What some of those experiences taught us is that how do we provide services when there's difficult conditions, the importance of telehealth. And so through all of our experiences, both with natural disasters, and Bob was indicating, we have so much unfortunate experience with mass violence and school shootings, which has made us more understanding of the importance of bereavement, grief, and loss, and how some of these events can interrupt that important trajectory of bereavement, and what do we need to do to support that, as we're seeing with the pandemic. So how does all this work, and how do we work with our network? So there's a few things that happen. So when the pandemic, and we started to see that there was a potential public health emergency, we started to think about what are those child-serving systems and services that might be impacted by this. So we, and my colleagues that are probably on the line, many of them work with different service systems like schools, child welfare, juvenile justice, residential. Our acute services for some of my colleagues work with trafficked youth, our homeless youth, those child abuse services, that, and including our disaster services that get activated, as well as thinking about our military veteran families and how this has impacted our health and mental health system. As we're working with these systems, we try to think about those factors that might influence how somebody might be responding to this event. So those developmental factors, and how do we change our understanding and our guidance for families of preschoolers versus families of adolescents, thinking about the impact of ethnic and racial and cultural considerations. Some of our families that we work with had developmental or disabilities that need to be understood, how we need to support them in a different way. As we're thinking about some of those socioeconomic, those health indications, even legal status or housing stability, these are all elements that we need to be contemplating as our network responds to these events. And we have to appreciate that for many of our communities and many of our families, this is not the only disaster or trauma that they have experienced, and appreciating what that previous trauma and loss history is so that we can understand how that might be influencing the way that they respond today. So as Bob was indicating, through our work with the network and partnering with a lot of federal agencies, back in 2004, we actually organized with the National Center for PTSD and the CDC a pandemic flu meeting, where we began to look at what are those behavioral health indicators that need to be thought through. Because there was some major natural disasters that happened, this actually culminated in a paper on those 5 basic principles that we keep in mind, whether talking about a pandemic as we are today, or when I'm responding to hurricanes. And I know this is Hurricane Awareness Week. So our group is also thinking about how we might have to adapt practices if some of our communities might be impacted both the pandemic and potentially a hurricane right now. And so through the work that we did from this task force, we thought about and looked at the research, experience of others, and want you to keep in mind 5 basic principles. And these principles should be thought through in the early days, just as we were back in March and in April, and as we move forward. How do we think about safety? So when we're for the pandemic, there are so many different safety issues that families and communities are struggling. First, it was, what is this virus? How do I protect myself and my family and my community? We are now also, how is it transmitted? What is some of the course of the recovery that people are still questioning? As we're thinking about reopening, it brings up a lot of different additional protective issues that families and communities are struggling with. But we also know, like any disaster, there are additional adversities that our families might be exposed to. And those are those economic hardships. In pandemics, there is stigma, especially for those individuals who have been sick before, sick, and there's concern that they might still be able to spread the illness. We know that there is racism and just general hate. Some of the protests that are happening, although there's some people are there for general advocacy, we also have been hearing messages of anti-Semitic and racist comments that are being fused into this, that we need to understand how those how that is disrupting and hurting those that we serve. As you've all heard, we're anticipating when there's economic hardships and concerns about our future, suicides can increase, as well as child abuse and domestic violence. So thinking about those things, what do we need to help to make sure that we address those safety measures? Thinking about how do we make sure that there's trusted information, that there's good resources, that people know how to get help. And even in factors of too much media viewing, we have learned in the literature that can actually cause increased distress. And we want to make sure that people limit that so that they don't stay in a state of distress. Second, we know that any of these events, including this one, that there is an array of emotions that come up. It can be fear, it can be anger or outrage that some of my liberties are being taken away, grief and sadness for the number, for those that have died, or worry about the safety of our loved ones. So what we try to do as we're thinking about safety, we need to think about what are those calming strategies that we need to be conveying from a public health community level, as well as to those that we might be providing services to. So the way that we communicate needs to be adjusted to the stress level we're at during that time. We need to think about ways to acknowledge and support those who have had a loved one die during this disaster. Thinking about those various coping strategies that help calm, whether that's religious practices or some of these coping strategies that we've been actually promoting through our UCLA Wellness Center, mindfulness, behavioral activation, and creating a way to have broad-based messaging of what are these reactions and why am I having them? What are those ways that I can help create that anxiety management or management so that I have that calming? And when do I need to get help and how do I get it? So the third strategy is self-efficacy. We know that all of us have strengths and our communities have strengths. So it's important for us to build off of those strengths. So have people show how they have dealt with other difficult times. What are those things that have helped them to get through that? Part of self-efficacy is allowing people to problem solve ways to get those resources that they need so that they can take care of themselves and their families, and connecting them to them so that they can have those supports. Part of efficacy is remaining flexible. So in any type of disaster, and especially this one, we know that there's going to be ever-changing guidance. There may be different waves of concerns where there will be higher levels of those that have tested positive, that we need to adjust our practices. The more we can help people to remain flexible and have contingency plans, the better that they're going to do overall. And really promoting that pro-social behavior that helps us cope, and it helps us to give back that feeling of strength in supporting one another. So those food banks, the senior hours, having community meetings, or those town halls that we've been having, so there can be an exchange of ideas, are really critical in promoting that self-efficacy. Our fourth strategy, so we dealt with safety, calming, self-efficacy, and that fourth is connectedness. And we know that connectedness is one of the most researched that shows support in helping us get through those hard times. So even in the pandemic, we have to think about ways that we can maintain that support, creating that sense of social solidarity. And that's going to be critical over time, because over time we're going to see that we're going to be at different places and what's needed for my own survival as well as the community's survival. And we're going to have to build a bridge of tolerance and appreciate that it's going to be people are going to have different needs, and problem solve ways to work on this. We also know that we have people more at risk right now. And why I mentioned newly isolated is that there are some folks that are just introverts. And I have to say, they've been joking a lot of, can people stop checking in with me and seeing how I'm doing? So we're not worried about those, that's their personality. We're worried about those that are really withdrawing from those support systems that they usually depend on. We're also wanting to make sure that we enhance that engagement and making sure that people have those true connections. And the last principle is the hope. How do we make sure that people see that we have gone through other hard times. Former President Bush had a great video this weekend, really talking about when he was president, how we got through 9/11, finding ways that we can show that how our communities have rebounded, how our families have changed can be truly helpful in giving that optimistic message. We also need to highlight that some of these aspects are temporary, but as we go through this, there are going to be changes to how we do things. So we want people to be flexible in those changes, but also hold on to, you have future aspirations. What are those things that can still happen right now? It's been so important to our graduates, whether it's our high school graduates or college graduates, to really let them know that they have just achieved a huge accomplishment. No one and no pandemic can take away that accomplishment. What's been taken away is how we celebrate it and how do we adjust so that they can still have that sense of pride in all of this. So kind of bringing this all together, we want to, and as I began the discussion, there are similarities to our work with natural disasters and with pandemics, but we always think about what's different about this. So you'll see that there's several elements of this that are same. But one of those things that makes this feel so different is just the global nature of everyone being impacted. This is the first time that every single one of our centers have been impacted in some way. That level of fear in the unknowns is greater in a pandemic. That national bereavement, the economic disruptions are much larger. And so we need to be thinking about how we create those behavioral health principles and extend to meet the enormity of some of the issues that we're dealing with. We also have lessons learned from other pandemics that really can help us in our thinking today. That we know that their perceptions of risk and consequences will govern our individual behavior and our community behavior. So those who have illnesses or conditions right now, or those who are elderly, are going to have different, know the different consequences to listening to some of the messaging that's coming out. We also know that different populations are going to have different consequences, as well as even different jobs right now. Risk messaging, it's important to get timely, accurate, clear, consistent messaging. When we have messaging that's starting to deviate from each other, that might be based, decision-making that might be based on fear or scapegoating, that's what erodes trust. That's what ends up increasing distress. We also have learned that the longer isolation is in place, the worse that people fear. So we always want to look at what's that maximum that we can protect somebody and it protects spread, but not have people isolated or quarantined at home for too long of a period. And we know that our first responders, and that's including our healthcare workers, do have additional vulnerabilities in all of this. So some of the research that's coming out of China really supports some of this, where we are seeing that the difficulties in sleep, some of the additional anxieties. But I do want us to highlight that issue of distress. As Bob was talking about, we have to be thinking about a danger paradigm, where our healthcare workers are truly making decisions about their own safety, their safety of their family, but it's safety of their coworkers. And some of that that distress is real risk for themselves, and we need to make sure that we appreciate that and honor that. So part of what we've been doing at UCLA is creating a behavioral health support for our healthcare providers. And I do want to thank Dr. Mioto for really spearheading this UCLA COVID-19 mental health group and allowing us and others to be members of her group. So we can think through what are those needs and how can we best support all of our behavioral health providers, not just those that do clinical work, but our team and our whole community, so that we can have that sense of solidarity. And in the work that we've been doing, we've been part of a lot of meetings, whether it's been through the dean's office or through the health system, of really capturing what are some of those unique needs that we're hearing from our healthcare workers. But I have also been on regional meetings and national meetings to find out what are differences based on what we're seeing out of New York or even in Washington, and how we can bring some of our thinking here to UCLA. And we want to be able to think about how do we help those specific issues. And see, these are some of our quotes from some of our colleagues in Philadelphia, talking about what is it like to actually have some of the changes with the PPE, the difficulties of sleep, and so many of our coworkers saying that they wake up in the middle of the night with their heart racing, that getting to work is much harder. Transitioning to the work, transitioning afterwards is much tougher. Thinking about a lot of us are doing the evaluation of our own reactions, our own symptoms, and seeing if I'm having any of those reactions, is there potential that I could be sick, or when's the last time that I might have been exposed? We know that our colleagues, you guys are all juggling with changes of routine right now, and really wrestling with how do I take care of my own children or my older adults or my partner as I'm dealing with changes to how I do healthcare. There's been concerns in many areas about the ethical dilemmas of how do I provide good patient care when there could potentially be shortage of services. And that so thinking about some of these things, especially those concerns about loved ones, and what is that doing to our coworkers, and how do we provide support, whether it's guilt feelings or just missing those things that provide us comfort, getting that hug from my child, when right now I might not feel that that's the right thing, because I don't want my child to be sick. There are a lot of different examples of reactions, as I was already highlighting. One couple I just wanted to highlight is that because this is a novel virus, one of the things that we're hearing about is just the feelings of uncertainty and sometimes helpless, that there isn't that one way to treat our patients right now, and it's creating a professional challenge. We're also getting to know and having a better appreciation of even some of the longer term consequences of this illness. And as we're beginning to grow in that, right now is just a very challenging time. So what we have been doing within the healthcare system in our wellness mental health program is we've created a 3-tier support model. In that first tier, we created an emotional support line. We've been providing broad education, but we've also been listening to our healthcare workers who are highlighting what are those basic physical needs that I have. For some, they didn't want to go home. So we actually were hearing that there might be some people staying in their cars. So it was important to open up Luskin Center as an option. The importance of having showers so that I can wash off before I return home. Is having that childcare support. What are those basic needs? That's tier 2. We've been mapping out and identifying what are those services or units who might be more differentially impacted by COVID-19, and putting in a mental health provider who can help create an individualized plan for that unit. Because we know that isolation and quarantine can be a difficult time, we've also been outreaching to those of healthcare workers who are at home right now and double checking, do they need any support? And we're keeping that support going of the peer support program that has been in play. The tier 3 is keeping in play those services that we have at UCLA, whether it's the behavioral wellness program for our medical school, our staff and faculty counseling services, and CAPS for our general students, making sure that each of these tiers gets are receiving the same messaging, that we're coordinating together at all times and adjusting accordingly. So with that tier 1, we have created this thinking about psychological first aid. And so we've actually created a field guide that's probably the most used and has been adopted by the Red Cross and the World Health Organization. If you're wanting to learn a little bit more about PFA than what I can do today, we have a free course on learn.nctsn.org, and you can get 6 free CME credits. So anyone that's needing to get your numbers up, please go and take our course. All of our manuals, including those for schools, those for homeless shelters, take a look at those. And we also have 2 mobile apps that, again, all of this are free. And so with psychological first aid, we are looking at 8 core actions, and not everybody gets them, but we want to, because we deal with a diversity of disasters and a diversity of settings of how we deliver, we need to think about how do we effectively engage those that might need help. Again, tapping into addressing those safety issues, as well as providing comfort to those who might have had something happen, like a loved one die or even a loved one missing, which we have in other situations. Creating a sense of stability for those who are having difficulties in the moment, and doing some information gathering so that we can think about what basic needs and supports that we can be giving. So as we trained, Brenda Birch and I have been leading our tier 2 supports. We've been doing training, and I think Brenda and I have done about 7 trainings. And what have been amazing in all of this is just how many assets have been within the UCLA campus and our healthcare system. So we've trained about 150 people to be part of this wellness support program that we've created. So those who are dealing with the emotional support line, you can also think about how do you, in your own work, if you're a part of a clinic or providing services, how do you actually provide PFA during these times? So if you haven't seen somebody in a while, it's important not just to do treatment as usual. Take a moment and see how they might have been impacted by this pandemic. Thinking about, is there any safety concerns or additional adversities that might be facing, those basic needs? Is there a missed opportunity, a life event, a graduation or a birth, or even not being able to have proper memorial services right now because of what they experienced? Are they using those coping strategies that you might be teaching them in your treatments, or that they have used in different stressful times? And how can we reinforce them, but maybe add some more given the current circumstances? Really evaluating, are they having those social connections, and connecting them to other services as needed. So when there's different waves during this pandemic, there may be times that you take a break in your care and double checking, is there something that I need to be thinking about and supporting those that we're serving in this moment, and adjusting our supports. Our next skills for psychological recovery is for our intermediate. It's really for this time period that we're coming up to in the pandemic, when we're going to have a little bit more time. We're not in that crisis mode. We might have some time to provide that support. We can actually integrate the skills building intervention and existing mental health and health services. We had great work doing integrated care after the oil spill in the Gulf region. And there's a lot of great work that's being done. The WHO actually has adopted SPR, and there has been a randomized control study out of Kenya that shows the practicality and the reduction of reactions from this. So again, the manual you can get from our website. And as of March, we do have an online course that you can take as well to learn a little bit more about SPR. So with SPR, there's 6 skill sets that we teach. Again, not everybody gets those skills, but it's important for us to appreciate what are those that are the most salient for any kind of community disaster response that we do. So part of it is that information gathering. What is those current pressing needs that might be impacting those that we're working with right now? So you might have your intake procedures, but I would say that we need to also adapt them for the current pandemic. So there's several screeners that are being adapted. Stoddard and Kaufman is just one of them, where they outline what are some of those disruptions that some of those that we're working with might be experiencing right now, and rating just how much those disruptions are, so that it may show you that we might need to emphasize this right now. If you Google, you can actually get this screener right online. It's pretty easy. So once we get through information gathering, we then want to, what's one of those 5 other skills that we want to be teaching? So one of them is problem solving skills. So problem solving is really thinking about identifying that problem, setting that goal, truly brainstorming what are options to address those, and then finding a way to create a plan to begin addressing that problem. And so with SPR, because it's a community intervention, we can actually do it in different ways. So we can think about it from an organizational level. So when we heard about that there are healthcare workers that might be sleeping in their cars, there can be trying to problem solve what are those things that we can be doing, and then putting them into action. We might be doing this one-on-one. One of our transitional age youth talked to us just last week about having some economic hardships and really being concerned about becoming homeless. So part of the brainstorming is what are those things that she needs to get help. And one of them ended up being, I know that there are these there's these additional funding mechanisms. I just don't know how to get started with it. So I need help with that. And so part of the plan might be even helping them fill out unemployment forms. We also work with SPR from a managerial level. So our group at Harborview in Washington have actually talked about having a daily huddle with their team so that they can problem solve together what are some of the issues that are coming up. So for them, research continued. And so they were finding that there was a struggle between what were some of the professional duties, the importance and ethics of keeping some of our research going, but also some of those struggles of how do I address things at home, and truly problem solving ways to address those issues. Our next skill is positive activities. We know, and including this one, disasters disrupt our normal routines and activities. And those activities help us with purpose, it helps us with control and pleasure. So what we're trying to do with positive activities is reestablish those routines, helping with those activities that create well-being and help with those that sense of downturn. We also have a skill of managing reactions. And with managing reactions, we're identifying those triggers or those distressing reactions. And then what are ways that we can be actually managing how we deal with that distress? So is it calming skills? Is it journaling or writing activities? Or is it even creating a plan to address reminders before they happen, like when we know when there's an anniversary coming up on the day, or even afterwards? Or when we know that people need to return back to where something happened, there might be certain cues that impact them. And so we try to help them think about ways to adjust during those transitional times. There are a lot of great apps, and we can use some of these apps to help with these calming. So as UCLA is promoting Headspace, for example, and it's they're allowing their services to be free for healthcare workers, we want to be able to make sure that these apps are embedded into a skill. So we want to, what are those reactions that we're having? What are some of these then tools that we can use, whether it's meditation, mindfulness, maybe behavioral activation, and then actually practicing when we need to use some of these. So during transitional time, coming to work, returning to work. I just want to highlight that the VA, as of this week, released their COVID Coach, which is a free resource that is for not just our veterans and military families and military, but in general. And it's a free resource, and I know that it's on both Apple and Android. UCLA, we have a wonderful professional wellness app that is connected without the E, that again can help providing support, and our mindful app. But helping people to use these skills in these apps in a way that will help them to identify that distress. There are self-assessments that can actually help us to keep that monitoring and create a plan of how to use them. So another skill, so we have info gathering, we have problem solving, positive activity. Our fourth one is helpful thinking. So with positive activities, we're trying to change our behaviors. With helpful thinking, just sometimes we've got to admit that just our thoughts can help keep us stuck. And we want people to see that sometimes, even if our thoughts are accurate, it's not helping us in these times. So we want to think about, what are those unhelpful thoughts? How do they connect with our feelings? And are there alternative helpful thoughts that can help us get unstuck, help alleviate some of the burden that are within our feelings and allow us to move forward? And our last skill is on social connections. And what I've learned over the years is that I truly highlight the healthy part. So many of us have been hanging out with our families at home, and that might have been great the first week or two. But it's now we know that interpersonal relationships might be a little bit more difficult. And so we want to identify, create that map of who do you have as supports, and do you have supports for those that when you need that advice, or if you're just having that bad day, or you had an experience at work that you just need to have somebody listen to you. Do you have someone to problem solve with? And what we also look at, is there anything that needs to be strengthened? So is there a support missing, or that needs to become healthy so that we can have more of that support network as we move through this? So as we think about the third tier, we do know that there are additional assessments so that we can think about differential diagnostics. And I can't get into all of that today, but here are some of the resources that you might be interested in. So the Stoddard and Kaufman, this is the link, but you can also, again, just Google it and it will come up. Our colleagues from Philadelphia have created another screener that highlights some more child and family oriented elements of this. For those that are wanting a screener on PTSD, our UCLA does have a brief screener that has been adopted for COVID. And our colleagues from Philadelphia have also created an acute stress disorder instrument that was based out of our colleague Richard Bryant's work out of Australia, and adapted it for the current COVID situation, so that we as healthcare workers or mental health workers, we need to take care of ourselves during all of this, and we can actually do a basic screener and see how we're doing, because that actually sets us up to how do we actually care about ourselves and not forget about the ABCs. So thinking about awareness, are we aware of how we're reacting? I talk with my colleagues a lot of, I don't want to become numb to what's going on around me. I want to make sure that I have an understanding of how I'm reacting to this stress behaviorally, as well as how my body is feeling right now. And are there times that I need to reach out to people? Creating that balance of truly being intentional in all of this. Or am I being intentional of creating those breaks that help that well-being, making me laugh, relax, or just have fun? Am I taking care of my body in this? And am I making sure I'm having those connections with my coworkers, my family, and my community? And most importantly, are we celebrating our successes? It's easy for us to focus on what's not working right, but the amazing work that is. And so my colleague Robin Gurwitch gave me this beautiful image. And are we a mindful right now, or are we mindful? And how do we make sure that we are mindful right now? Because we have to have clarity when we're wanting to make important decisions in our life. And so when we're providing help and wanting those connections, I do want to highlight that if anybody ever wants to reach out to the emotional support line, there's a couple of mechanisms to do that. That is the email, the UCLA wellness program at WP@Mednet, or you can text or call us. But if people aren't wanting those supports, or you're working out in the community, there are suicide and domestic violence hotlines, as well as hotlines for our veterans and even for our Native populations. So before I wrap up, I just wanted to highlight some of the resources that our network has created that you might want to take a look at. Some of this is to support our caregivers on how to navigate this with their kids. We also know that there has to be special attention to those kids whose loved ones have either been sick or have died, or even because of their families being first responders or healthcare providers, there may be brief separations that they don't understand. And so we have a resource that helps, how do you support kids with some of those issues? We have a fact sheet series on economic hardships. Again, using those 5 principles that we talked about in the beginning: the hope, the calming, the connectedness, the self-efficacy, and the safety issues. How do we think about that from an economic hardships? How can parents think about that? Our community leaders, our youth, as well as our school personnel. I was happy to join forces with one of our coworkers, and we created a children's book for some of our younger kids, and having them having parents talk to the kids about what are some of the changes that they've been having. Because there's different aspects to the pandemic, we also have Trink and Sam, these little preschoolers or school-age kids, have lots of questions. And so depending on what your families have experienced, they might want to add some of the questions into the main book. So if they're worried about a loved one being sick or their loved one dying, you could add those elements in. If that's not something that family has experienced, then they don't need to add those in. So there are several resources that I think that you might, we are constantly updating our UCLA webpage on some of these resources that we talked about. Through my federal partnership, ASPR has a collection of resources from all the federal agencies, as well as some of the groups that I mentioned earlier on my talk. So I just want to acknowledge, as I wrap up, I want to thank my partner in crime and my tier 2, Brenda Bursch, as well as Karen Mioto, for allowing us to be part of the team in thinking through things for the UCLA health system. To Robin Gurwitch and Lisa Maya Jackson, it's been great to support our respective healthcare systems and learn from each other, as well as, of course, Bob Pinus and Alan Steinberg in this. So with that, I'd like to wrap up and maybe turn it to some questions and answers.
Great, thank you, Dr. Brymer. That was extraordinarily helpful. So let's move to the question and answers. I can start mine. Good. See me again.
So one of the questions that was asked is that if I'm not connected to a certain group, how can I get involved with potentially volunteering or being part of a support, whether it's with this disaster pandemic? So there's a couple of avenues. The Red Cross does have a disaster mental health service, and they're actually doing support right now. They are trying to even have a specialty support for this pandemic, where they're creating a website for those who are bereaved, who have a loved one died, and then having some supports. That website is right now being activated for the region, Eastern region, but by the end of the month, it will be available here on the West Coast. That might be one area that you want to provide support. There's also CERT teams that in every community, there's community response, emergency response teams that you can get to volunteer, as well as the Medical Reserve Corps. Those are kind of three options that you might want to look at and see kind of what fits within your schedule.
Let me, may I make, while you're looking,
Yep.
Melissa, let me just make a comment that the principles, I think it's very important for our Department of Psychiatry, the principles that you've been discussing and giving details can be integrated into everyday mental health practice, is what Dr. Brymer is suggesting. So it's not routine for us to map out the social connectedness. Who's the person they call about this, that, or another thing, and how to make sure they do that. Is there a person they know living alone that they might wish to reach out to, who's been a friend, but they know is by themselves for a pro-social activity? There are ways to support these activities, even as integrated into the everyday care that you're giving for already pre-existing mental health conditions. And I think that's one of the reasons for this presentation, is to suggest that these can be integrated into your practices.
Another question that came up is that this person is seeing that there's just some staff that are trying to avoid providing care for COVID patients, and how to respond to sometimes that negativity. And one of the things that what we found, especially with our colleagues from Washington, is that when we have team meetings or huddles and talk about what are those issues that are coming up, sometimes we find out that what's being perceived as negative is true concerns that are in juggles between home life and work. And the more we can have two-way dialogues of what are some of those issues that our staff are dealing with, there may be practical ways of getting them engaged. And so sometimes when we stay in more of the upper level policies, we don't get into those very specifics. So having those dialogues, being able to ask what are those things that would help them to be able to provide that service, may be able to help them to get to that next level.
So how do they get Trina and Sam, was somebody asked, Melissa?
Trina and Sam can be on our website. If you look at the UCLA wellness email on Wednesday, it's on our UCLA wellness, as well as on the www.nctsn.org. Again, it's free and something that you can be using. There's a parent guide at the end to help parents have additional conversations with their kids if they choose to.
There was a question about resources regarding religion, and I want to point out that Dr. Brymer also has overlooked a version of PFA that was actually put together by the Fuller Theological Seminary and the interdisciplinary panel of chaplains in New York City, that actually was reviewed around the world by different religious leaders of different religions to make sure that the way in which religious leaders can message the same psychological first aid. And it's been used again across the world and is available for those who are interested in that dimension.
Absolutely. And so one person was asking, can there be some training to help people with that time of self-isolation or quarantine? And absolutely, using some of your cognitive behavioral training or others. That's why we need to think about behavioral health principles during the planning phase, in the response, as well as the recovery. So whether we think about being in isolation or quarantine because of potential exposure, or we have hurricanes where we know that sometimes there's periods where there has to be sheltering in place, helping people to cope with those times, addressing anxiety management, talking about how to intentionally schedule yourself during those times, are all principles that we can be helping people to cope, but also being okay to say when I'm not okay, and reaching out and creating those social connections can help during those times so that we can reduce those periods of isolation and the negative effects of some of this.
But that can include practical issues. Our hospital actually got some, I think, gifts from Apple at some point for chargers, so that people coming into the emergency room with their iPhone or whatever else didn't run out of charge while they were there and can keep in contact. So the practical side can make a difference too. You need to review those issues along with the connectedness and emotional side.
Absolutely. So I think with that, I'll make sure that I see that some folks want the slides, so I'll make sure I work with the organizers to provide them so that you can see some of these extra resources. Again, a lot of the resources that I did mention are on our UCLA mental health awareness page. And so we're constantly updating, and as more materials come up, we will make sure that we have them so that all of you have those resources.
Thank you.
Well, thank you so much, Dr. Brymer and Dr. Pinus, and thank you all for being here. For anyone who wasn't here at the beginning, just a reminder that there'll be a survey sent out for CME credit, so check your email after that. And thank you all again, and have a great rest of your day.